come up to London to speak with Dr. El-Gingihy about his book, How to Dismantle the NHS in 10 Easy Steps. Yusuf, thank you very much for seeing me today. I just wanted to discuss your book, amongst other things, How to Dismantle the NHS in 10 Easy Steps. And viewers, I urge you to read this if you haven't read this already. It's a fantastic achievement. And it really breaks down what's happened to the NHS over the last 30 years and explains how we got to where we are now in a very accessible format. But can we start with step one, which talks about the internal market and where the internal market came from and what sort of damage is that doing?
Yeah, absolutely. So I guess the first thing to say is that it's a tongue-in-cheek title. Obviously, I'm in favour of the NHS. I'm not in favour of dismantling it. The blueprints were written a long time ago, back in the 80s. We'll come back to that. But yeah, step one was creating what's known as an internal market inside the NHS, and it's one of these technical, kind of euphemistic terms used by policy makers and think tanks, and it doesn't mean very much to a lot of people. So what the idea was that from the 1990 legislation, they brought in basically a limited market inside the NHS. So during the 1990s, on the premise that bringing in market forces competition through dividing the NHS up into trusts and into what's known as the purchaser-provider split. So purchasers of services being GPs and community services, and the providers being hospitals. And the idea was that by doing all of that, that you would have NHS trusts competing for custom, as it were, for patients in order to provide services, and that would make the NHS more basically efficient, more cost-effective.
Certainly what we see now, and certainly what I see working in the NHS. So step two talks about public-private relationships. So we've now got the internal market. So where does the public-private relationships come into it?
Yep. So what's known as public-private partnerships, PPP, was something actually really brought in during the New Labour years. So this is, as you've said, the second step, so from about 2000 onwards, under the Blair Brown era, we saw really the idea of what was sold as the NHS or even other public services working with the private sector in what was presented as a partnership, that the private sector would come in and help the NHS to improve and to do things better, apparently. Now, this meant, for example, that you had public-private partnerships with things like waiting lists for elective surgery, for elective operations, for example, things like hip and knee joint replacements, cataracts, where there were big waiting lists, big hangover from the 18 years of Conservative government. And something that was created was called ISTCs, Independent Sector Treatment Centres, too technical again, but it was the private sector being brought in to carry out the overspill from these very long waiting lists. And in fact, this turned out to be a huge kind of fiasco, where they were paid a lot of money to do a very small proportion of these elective waiting lists, and it ended up being more costly, more expensive, and in some cases more dangerous than the NHS. So it was just the kind of the first, one of the first of many, sadly, examples of how the private sector being brought into the NHS has been fairly disastrous. Now, the most toxic legacy from that period we now all know to be PFI. So that's the most kind of infamous example of public-private partnerships, was the PFI, the Private Finance Initiative.
What sort of impacts is the PFI still having?
So yeah, PFI absolutely isn't a problem from the past. It's living with us right now, and it continues to kind of unleash its toxicity. It's now been this year in the news a lot because of the likes of Carillion going bankrupt. But yeah, originally PFI was, instead of the government or taxpayer publicly funding infrastructure projects like building new hospitals, alongside all kinds of other stuff outside the NHS, such as schools and prisons, roads, railways, and so on. The idea was you brought in the private sector to finance, to build, and to run these infrastructure projects. So hospitals were the biggest part of PFI, and the result was that over 100 PFI hospitals were built under New Labour. The idea was originally actually brought in during the John Major administration, contrary to kind of popular belief on this subject. But admittedly, it only truly came into its own and expanded under New Labour.
It sounds quite a good idea to inject private money into, public sector where the public sector is struggling, hasn't got the capital. Private has got the capital. Seems like almost a perfect relationship if they can provide the money.
Well, exactly. Like a lot of these ideas on the surface, it seems like a reasonable concept, and that's exactly how it was sold from the top down, from Blair, and particularly by the likes of Alan Milburn, who was one of the early New Labour health secretaries, and he even famously said he was described by Private Eye as an almost maniacal convert to PFI, and he once said, "It's PFI or bust." So there was this idea that you've got a limited, as you say, amount of money, and you don't have a choice. How are you going to cope with 18 years of conservative kind of neglect and cuts and so on? Well, you have to turn to the City of London to help finance these things. The reality is that the NHS, and in fact the UK, has been left with a huge PFI debt, which is, for the NHS alone, it's up to about £80 billion for those 100 hospitals. It should have cost about £11 billion. So that puts it in perspective that it's going to end up costing something like 7 times the amount, which is pretty jaw-dropping. So to give a kind of more concrete example, because these figures can get a bit kind of astronomical and abstract, where I work in Tower Hamlets in East End of London, we've got the main hospital is Barts and Royal London, which is kind of a world-famous hospital, or hospitals, and the PFI there's the biggest in the country, and that's they're paying over £2 million a week in interest on their PFI to this corporate consortium, which is Skanska. Innisfree. So you've got these financial companies. Innisfree is a fund management company in the City of London that employs something like 29 people according to its website. And behind that you have actually big banks. Behind those smaller financial interests, you have the construction firm, which in this case is Skanska. You have then other companies, facilities management companies, which run the hospital services. So that's the whole consortium. They're paying all of that money to them, and therefore, in the case of that one hospital alone, it would have cost about £1 billion if you'd built those, what are actually 2 new hospital projects across that trust. It should have cost £1 billion roughly. It will end up costing £7 billion, with that £6 billion extra going to those corporate interests.
Incredible. When are they due to pay off?
I think it's 2049 off the top of my head.
2049.
Yeah. So these are basically, think of it as a mortgage. It's like going to the bank, getting a mortgage to buy a new home, but it's an extortionate mortgage with kind of watering interest rates, which ends up bankrupting the household. That's kind of a good probably metaphor, seeing as the government's quite fond of comparing the economy to a household, which is a very kind of flawed analogy anyway.
That's absolutely astonishing that it's that much, considering the Bank of England's base rate now is 0.5%.
Well, exactly.
And that's considerably more.
So obviously with the PFI crisis and the outsourcing crisis now gathering speed, we've had remarkable kind of populist rhetoric from the chairman of RBS, no less, who on Question Time said that PFI was a fraud committed on the people. Those were his own words.
RBS should know.
Yeah, the current RBS chairman, which is rich because RBS, alongside other banks such as HSBC, was very instrumental in getting PFI up and running, and they continue to make huge profits from it, and it's become a global thing. So it was always envisaged that public-private partnerships, PFI, will be exported across the world, which it has been when you go to places in the Middle East, for example, such as particularly after the kind of the wars and the interventions in Libya, Afghanistan, for example, where there are these public-private partnership projects. So this is a huge wealth extraction process where you have a captive public sector in the form of infrastructure projects, and you just basically suck as much money as you can out of it. And unsurprisingly, then those public services start to fall apart.
All under the name of market efficiency, which is
you sell it as, of course, as efficiency.
Yeah,
it's efficient in one sense
in extracting
in the wealth extraction.
Yeah. And when we talk about the influence that private money's had, as an activist, I'm always speaking to people about how the NHS is being privatised, but sometimes a really hard sell, even people who work in the NHS, because they still come into the NHS building. If you're patients, you still see the NHS logo stamped everywhere, same if you go to a GP surgery. You're not seeing Spire or Virgin anywhere involved. How do you go about explaining to people that this is happening?
Yeah, I think that's a very good question, very important point. There's different types of privatisations. And when we look at the history of privatisation of public services in the UK, which has been a real kind of world leader on this front, sadly, when you think of British Rail, when you think of more recently the Royal Mail, there's different models of privatisation. One is that you obviously sell shares, as happened with utilities, for example, utility companies, and that's obviously a very different type of privatisation to what's going on with the NHS. And I think one helpful definition is the one used by the WHO, the World Health Organization, which stated in the 1990s that privatisation of healthcare means the increased financing and or provision of services by non-governmental actors, so by the private sector or possibly charities, for example. So when we're talking, what do we mean when we're talking about privatisation in the NHS? Well, what's going on underneath, as you've stated, under that logo, under that umbrella, is a kind of a huge plethora of private sector and market activity. So we've mentioned some examples already. So, for example, private companies brought in to do waiting lists, PFI, where you have a corporate consortium of banks, financial companies, construction firms, facilities companies running over 100 hospitals, financing, building, running them, effectively in some cases owning. It's been reported that HSBC owns 3 hospitals outright, effectively, because the other partners have sold their stake to HSBC, except you won't have seen that on the front page anywhere, that HSBC owns NHS hospitals. So it's pretty remarkable things going on. When you're hearing all the time that privatisation isn't happening, doesn't exist, conspiracy theory. In other ways, it's happening in all kinds of other ways. So, for example, outsourcing. So we've seen the amount of private sector outsourcing in the NHS double in recent years, from about 4 to 8% of the budget. Some may shrug their shoulders and say it's relatively small amounts, fair enough, but that's following legislation that was introduced about 5 years ago. So for the figures to have doubled is fairly substantial over such a short space of time, and it's only going to go up further.
The Health and Social Care Act 2012.
Yeah, exactly, which we'll come to when we. That's the kind of big flagship legislation that was brought in by the coalition, the Conservative-led coalition, obviously. So this was back in 2013, but we'll come back to that. So that's another aspect. One of the other consequences of that was that hospitals are now able to make up to half their income from private patients. Again, a little-known thing that's kind of gone under the radar and hasn't been covered really by the media. So if you look particularly at the kind of big centres in London and across the country, Royal Marsden is a good example. World-famous cancer hospital is now making, according to the Times, making up about 45% of its income from non-NHS sources, so from the from private patients and other non-NHS sources. So that's almost half. It's pretty remarkable. So this is the kind of picture when we're talking about privatisation, where hospitals themselves are now turning into two-tier systems.
Yeah. Another interesting bit in your book talks about management, and within the NHS, it's a huge organisation, and you need the right management in the right place. But what your book talks about is this revolving door. And so what sort of effect has that had on the NHS and the move to privatise?
Yeah, so this is, again, another key point. I mean, one of the things maybe just before kind of coming back to that we didn't talk about earlier on was when the moves were first made in the 80s even to bring in outsourcing and market forces, the private sector. The kind of really, this is the bit where you need to pay attention if you're dozing off, because this is right at the crux of this whole debate, is that a publicly provided, owned, funded healthcare system just happens to be the most cost-efficient way of providing healthcare. When we look at the literature, when we look at the evidence, the data, not just here but across the world, so in Germany and Canada and the US, what we've seen is that when you bring in outsourcing, when you bring in the private sector, costs basically skyrocket, they escalate, and that's because you basically end up, ironically, when you bring in market forces, you end up bringing in this huge bureaucracy of things like tendering of contracts, bidding for contracts, payment tariffs, setting up, dividing the NHS up, in this case, into trusts, hospitals running as businesses, auditing, and then you need tiers of administrators and managers to run all of this. So that's one reason the costs escalate, and you only have to look at the US to see how costs really get out of hand in a kind of a privatized system. But there'll be people who'll go, well, stop talking about the US, there's other healthcare systems. Yes, there are, but even when you go over to those mixed systems in Europe, they are more expensive because they're mixed systems. So you have a lot more of this market bureaucracy and administration. And in fact, the Department of Health knew this really early on. They commissioned their own study, at least one study into this, and then hushed it up because it showed that admin costs had gone up by nearly 10%. So we think that marketisation process costs, between 4.5 to 10 billion a year. Just for that limited market, it's probably gone up significantly since, but no one's counting. So if you go over to the US, 1 in 3, this is, sometimes we're getting a bit too kind of dry and technical, but unfortunately it's the kind of subject where you sometimes have to be a bit dry. But you go over to the US, they're spending 1 in 3 healthcare dollars on administration. So you have to unwind all of that, kind of remove the ideology, and go back to to try and restore a publicly provided and owned healthcare system that just is much more cost efficient, and we have to kind of expunge the smoke and mirrors, which is confusing, all of this. But yeah, I've gone on a bit of a slight detour there. Your question was obviously about management.
Yeah, because it's really important that we get it right, because obviously the NHS is often criticised for poor management, inefficient management. But this story about the revolving door.
Yeah, very quickly on management, that was one of the first things that happened. Was Thatcher introduced hospital management, or NHS management, and that was very clever, because previously, you go back to the golden era of the NHS from 48 to the 70s, you had doctors and matrons running hospital boards, and so you had healthcare professionals running NHS services. So bringing in a business class, a corporate class of managers to run the NHS was a very clever way of basically removing the grip of the healthcare professionals. And that's the function of a bureaucracy, is that you separate responsibility and power. So the healthcare staff were then, or healthcare professionals were relegated to merely the day-to-day clinical responsibility, but they had no control over the policy making, the decision making, the power. So it's a very clever first step where you create this very well-paid, best paid class of corporate managers in the NHS, and they implement your instructions. And part of that is the revolving door, is that we see this huge revolving door, not just in healthcare, it's across every sector, isn't it? It's been well noted in defence policy, but going back to the NHS, we see a revolving door between the public and private sectors, where not just with NHS management, but also the top levels of the Department of Health, with health ministers, health secretaries. They will perform their role in the public sector, and then they will go off to often to work in or advise lucrative private healthcare interests or other corporate interests benefiting from NHS privatisation. So this is a very clear-cut phenomenon that is one of the strategies of corporate capture.
Significant, isn't it? You also took in your book about a smear campaign within the NHS, and for as long as I can recall, I can remember stories about how the NHS is underperforming, failed hospitals, long waiting lists. You constantly hear the stream of how the NHS does not work.
Yeah, absolutely. Yeah, run a smear campaign. I mean, when we say run a smear campaign, well, you have to remember there's a huge apparatus behind this kind of juggernaut of privatisation. We're talking about big banks, obviously the private healthcare companies, insurance industry, but also the big four accountancy firms, the likes of PwC and Deloitte and KPMG, the Magic Circle law firms, the big three management consultants like McKinsey. So all of this apparatus is kind of engaged in week in, week out, kind of defining and producing NHS policy reports. And they're constantly pushing for absorbing and reshaping and co-opting the NHS into the whole system of a deregulated global free market. And they don't understand the concept of a public healthcare system is something that's completely alien to their worldview and of course to their ideology that deregulated free markets should run everything. And so what you see is that you have obviously a right-wing media owned through concentrated ownership by billionaires, by big transnational companies, which is quite happy to obviously to facilitate that process of privatisation and of denigrating the NHS, of smearing it. So when you look at particularly the tabloids such as The Sun, or owned by Murdoch, or the Daily Mail, owned by the Rolls-Royce, or the Daily Telegraph, owned by the Barclays brothers, then they're all kind of on a week-in, week-out basis engaging in a massive smear campaign. But you also see it even in other parts of the mainstream media, in even the kind of liberal outlets have partaken in this as well. And it's very sad, isn't it? And yet it doesn't. It works in some ways, and yet it doesn't in other ways. So the NHS remains sacred. Critics will obviously say a sacred cow, but for the British public, it's the affection for the NHS. In that famous Ipsos Mori poll, it came above the royal family. So it is, I guess, as Nigel Lawson once described it, the closest thing to a religion.
Noam Chomsky is often heard saying the standard protocol for privatisation is defund, wait until the public get angry, and then set it off. Yeah. And Tony Benn said that, like you said, the NHS is the closest thing to the religion we have in the UK, but if they were to set it off, there would potentially be a revolution. But do you think now, with the smear campaign that's been going on for so long, do you think public opinion is beginning to shift towards the idea of having more private involvement within the NHS?
Yeah, I think it's part of a much bigger question. It's what kind of society do we live in? We've seen now several decades of what we call neoliberalism, of this orthodoxy that deregulated free markets should run everything. So I guess when we're talking about public opinion, then that is shaped obviously by the current status quo. And we see these ideas around market forces, competition, the private sector being brought in to run everything, is what imbues everyone, most people's worldview about things. So sadly, I think public opinion could potentially shift if things continue in this direction of travel. But at the same time, I think the British public is very much against the idea of private insurance for healthcare. I mean, they know full well that that would be disastrous, which is why one of the things that the establishment or this whole apparatus of interests is trying to sell them is, oh, well, we could move towards a kind of European mixed model. That's how they're trying to sell it right now. So, yeah, this is, I mean, it's a very interesting question because it goes back to the early think tank documents. It goes back to things like the Ridley Plan for privatising the nationalised industries, where they talk explicitly about doing this by stealth, because you can't take this front on. It just won't work. So, it's interesting area.
So moving on, we talked about how much the private influence the NHS so far. How much has been lost to the private sector now?
Well, obviously, as we said, with outsourcing, private sector outsourcing in the NHS, that's gone up to about £9 billion. Those are the latest figures, but they have, mind you, 2015-16, so it's probably higher than that. But that doesn't give you the true extent of privatisation. That doesn't factor in the cost of running a market in the NHS, which we've said, could be up to 10% of the budget, probably more, because that was in the 90s, that estimate really. It's not, it's looking at that period, it's not looking at everything that's happened since in terms of PFI, public-private partnerships, expanding outsourcing, hospitals having, up to half their income from private patients. So the costs are liable to be of privatisation. We're talking in the tens of billions. You would guess. One think tank, the CHPI, the Centre for Health and the Public Interest, estimates that the cost of privatisation is as much as 22 billion a year. I would guess that the figure is somewhere between the two, but it's liable to be a significant chunk of the budget, probably between 10 and 20 billion.
It's amazing, yet we can't afford to run the NHS. If you listen to the BBC, it's a really disturbing fact that I use all the time, actually, that you mention in your book. The amount of beds per 1,000 population. And when you look at the UK and then when you look at Germany, there's a significant difference in the amount of infrastructure that's already been put in place. The 2.6 beds in the UK, 8.2 in Germany. Yeah,
well, it's good you've got those stats to hand. Absolutely, our bed to population ratios are now below some Eastern European countries, for example. And for the fifth or sixth biggest economy in the world, that's just shambolic. The reality is we've lost something like a third to half of NHS beds since the 80s. So when you take an area like mental health, where sometimes children or adolescents or adults, of course, have to travel hundreds of miles to access an inpatient mental health or psychiatric bed, it's no surprise.
Look, where are we now in the transition between a completely public NHS, as it was pre-1980s, to now this monster of private and public?
Yeah, it's certainly not the model that Anya and Bevan, the founder of the NHS, envisaged, which was that publicly provided and owned model of healthcare. It's now a market system, and it's on a one-way road to privatisation unless we stop it, which we'll come to. You've got a situation where, as we've said, you have effectively a funding stream which is now being administered by these CCGs, clinical commissioning groups. They're supported by units that some of whom are being outsourced or privatised. Some of that funding stream is increasingly being diverted to other private companies for running services. You have some of it going to hospitals, which are now increasingly semi-independent businesses, in effect, with two-tier healthcare with NHS and private patient wards. You have all of this going on. You have a whole plethora of other companies which are providing catering, cleaning, laundry, clinical services, administrative services, all kinds of particularly in hospital, logistical delivery. So there's all of this going on, and patients now being handed personal budgets. And one day that may well lead to top-up payments. So that's how you integrate all of this ultimately with the insurance, private healthcare and insurance industry. But going back to where we are beyond this, currently the government is bringing in something called integrated or accountable care, which is a US model of healthcare. Basically, it's a system where you have at least initially multiple providers involved in your health and social care, but ultimately you have one provider which would run health and social care services for a region and subcontract services to some of those other providers. So that's the basic setup. It's meant to be more cost effective than what they have as standard in the US, because you've got all of these providers working together supposedly, and the financial incentives are aligned so that they have more savings if they work in a more kind of integrated, coordinated way. And so this is being sold as somehow reversing the competition and the privatisation and so on. But in reality, it's not doing any of that. The original NHS model is not what the government is trying to now restore. It's actually a consolidation of privatisation. But they're very, as usual, the kind of spin doctors have been at work, but PR is a very good sell. And accountable care is really in the US, where integrated care is what's used for Medicare or Medicaid, the kind of threadbare safety net for those for the poor and the and older people who can't afford good insurance. So that's not really a model we want to be bringing over here. And the danger is that now they're carving up the NHS basically into 44 footprints, and these kind of big chunks can then be essentially peeled off and run as these accountable care organisations with one provider. And because this isn't being done with legislation, it's not going through Parliament, so there's no parliamentary scrutiny. You could have non-NHS, non-statutory bodies running health and social care services. So basically, there's nothing to stop a private healthcare company or an insurance company from running these huge chunks of health and social care for whole regions in the future. And that's not something theoretical. In Nottingham, we've already seen this starting to happen. We've seen the contract to bring about this transition going to partly to a major US health insurance company called Centene.
It's the free market infrastructure without the free market, because people don't have the choice to go anywhere else. They're told that they need a knee replacement, and they haven't got a whole selection of expertise they can go to, or accountable care trusts that they can use. So it's purporting the free market principles of efficiency without adding any efficiency to it whatsoever.
Yeah, I mean, one of the things New Labour tried to do was to create a kind of a choice menu for patients, that you could go and get your operation or your treatment anywhere, and that the best providers, therefore, through competition, would attract the most customers or patients. But healthcare, it's not, as well as other, or social care or other public services, they don't operate in the same way as, say, supermarkets or consumer products, because essentially, cite one example would be that when you're looking at kind of rural areas or areas which are sparsely populated, then you start to run into huge problems with market forces and so forth, because it's not profitable to provide a service on the Isle of Skye or wherever it might be.
Yeah.
But the whole point about essential public services is that you do provide them because that's what people need, rather than what is profitable. So it's these kind of problems which were elucidated a long time ago by people like Ken Arrow, who was a Nobel laureate in economics, that you can't apply market forces to healthcare. It doesn't work very well. Competition doesn't work really in healthcare. And we've outlined some of the reasons why it's very problematic, because costs skyrocket. And another reason the costs skyrocket is that private companies have an obligation to their shareholders to make profits. And so they end up basically cutting their overheads, cutting services, providing the minimum acceptable service they can get away with, and making as much profit as they can through what in some cases amounts to wealth extraction. So these are some of the real problems with market forces in healthcare.
Also, in my experience, the NHS trusts often share information, they share good practice, and that ends when you've got these market forces involved. When you've got private companies, they're not willing to share because their primary target is efficiency, is the customer, and is the end share dividend for the shareholder.
Yeah, absolutely. So that's one of the big things that really happens with marketisation and privatisation is you see fragmentation. So if you take, an example like diabetes care pathway, you can end up with multiple, providers providing what all kinds of things such as eye care, foot care, the management of the diabetes itself. So that ends up with a chaotic kind of fragmentation. We've seen that also with, for example, NHS Direct, when it was then parcelled out into these kind of competitively tendered contracts, and we saw suddenly 30 different contracts to provide what was actually seemed to be working reasonably smoothly as a kind of a helpline for patients. Suddenly you had the fragmentation of this one service into all these other contracts run by different providers, paid less than they were previously, and so it became chaotic. And that's the chaos you see with the free market system, is that there's this idea amongst the kind of ideologues and the neoliberals and the vested interests and the corporate and financial elite that the free market is just some kind of force of nature, that it allocates resources and outcomes in the just in the way that it should be allocated, and and it just can't we can't do better than that or whatever. But the reality is that if we just have planned, integrated, publicly funded, provided, owned, run and accountable public services, then you can provide things actually in a much better way. There's no reason why the Bevanite, the original model of the NHS, can't work smoothly in the 21st century. There are obviously things which we can add to that to make it a more progressive, optimistic vision for the 21st century. I think we shouldn't necessarily be just harking back to a state-run healthcare service, because ultimately that potentially ends up being kind of privatised, doesn't it? If you're not careful. So I think the state, certainly the state-run NHS was superior to this market model, but I think we should be fighting actually for a truly public and democratic NHS and other public services, by which we mean that healthcare professionals, patients, and communities should run their health and social care services, or for that matter, anything. Their utilities, their own workplace.
I think few people would disagree with the NHS would be a better place if it were completely publicly funded. So what can people do? They're angry about this. They watch this. They see it's not right. All this private public money being pumped into private companies. What can people do at home?
So basically, in summary, the market and privatisation experiment inside the NHS has been catastrophic. We have to rewind that, reverse it. We have to remove the private sector, the likes of Virgin, which has won about nearly £2 billion in NHS contracts in the last few years. We have to get rid of those companies, such as the Virgins, the Sercos, the United Healths, the Carillions, from the NHS. We have to get rid of the market inside the NHS. We have to get rid of outsourcing. We have to certainly resolve the question of PFI. And we've got the legislation which is kind of gives us the basic framework to do this, and that's called the NHS Reinstatement Bill. It's co-authored by Professor Alison Pollock and a barrister, Peter Roderick, and it's been in front of Parliament already. It's going to come back to Parliament. Obviously, under the current Conservative government, they don't want to touch anything like that with a barge pole because that's against their ideology of the private sector running everything. So we have to bring in really a progressive government, and that would be a Corbyn-led government, or any other progressive government for that matter, that is prepared to adopt these common sense, evidence-based proposals. And interestingly, Jeremy Corbyn, John McDonnell were actually two of the earliest signatories to this NHS Reinstatement Bill, which would aim to renationalise, restore the NHS as a publicly provided, owned healthcare system. So I think that's one of the legislative solutions in terms of what people can do. It's very important that you get involved in local campaigns and groups, whether it's Save Your Local Hospital campaign or the local branch of Keep Our NHS Public. Obviously, if you're a healthcare professional, you might wish to get involved with your kind of local BMA branch, or you might wish to join something like Unite or the MPU, Medical Practitioners Union. If you're in nursing, if you're a nurse or a student nurse, you may wish to get involved in the kind of bursary or bust campaign to reinstate the student nursing bursary. So there's really a campaign for everyone.
Yeah.
But the important thing is to be, I think, particularly involved in your area locally. Find out, educate yourself about what's going on, what services, what hospitals, what GP surgeries are facing cuts, closures, what is being outsourced, what's being privatised. Attend those CCG meetings, the health scrutiny meetings. Ask difficult questions to those people who are making local decisions. And sometimes they're between a rock and a hard place, but it's only by doing this that you start to fight and make changes and win. And it's important to underline that this isn't as depressing as some of this has all sounded. We've had plenty of victories. And we've seen, for example, in Lewisham, in the last few years, the campaign there to save Lewisham Hospital, which put those plans on hold. We've seen that elsewhere. We've seen some really big, kind of a big groundswell of campaigns up and down the country, especially around hospital closures, GP closures. So up in Yorkshire, there are some very big NHS campaigns around GP surgeries, particularly down, obviously, in the south, where you are, in Brighton. There are big NHS campaigns there too, fighting all of this, the cuts, the closures, the privatisation. In Gloucestershire, they won against plans to privatise and outsource services. We've seen more recently, obviously, the junior doctors, which ended with a whimper rather than a bang, but it was a remarkable thing to behold. 50,000 junior doctors carrying out the biggest industrial action in the UK. I certainly didn't see that coming. I obviously definitely would like to take credit for it because it happened straight after my book coming out. But jokes aside, I mean, that's just the beginning, I think, of the politicisation, the awareness of healthcare professionals, of the public. When I started doing this kind of NHS campaigning back in 2011 or so, and writing about it and so on, it was a very different scene. Privatisation was, the idea of NHS privatisation was kind of really non-existent in people's minds. It's now much more at the forefront. When you're looking at polling of the electorate, of the public, they're saying that the NHS is, the main issue for when they're going to vote in elections. If the main issue, or at least one of the top three issues. So it's I think there's lots of grounds for optimism, and I think there's a good chance that in the next election that we could see a Corbyn-led Labour government. Of course, the fight would then begin from there. It would, that wouldn't be the point at which people should just go back to ignoring this, because we would need a broad-based, bottom-up grassroots movement with all these local campaigns kind of coalescing into a national movement to basically save the NHS, and in fact to go much further than that, which is to completely reshape our society. I think with a progressive vision, you can't just save the NHS in isolation.
No, because it's perhaps the greatest socialist experiment that this country's seen, perhaps the world's ever seen, and it was a success right up until the 1980s when they started to privatise it. And to say that it doesn't work now and is an unworkable model is just nonsense, as you rightly point out in your book. And I urge, again, people to go out and read this book. If you haven't read this book, it really is incredible, incredible achievement. And I think useful, leave it there. But thank you very much for your time.
Yeah, thank you.